Let's bring in our next guest, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Joe, what do you have for us, my friend?
Hey, Ray, how you doing today?
I'm doing terrific.
Good. It's, we're in mid-April now, and everything feels so good. When you go out to the high schools, I'm not kidding you, Ray, it looks more like April. So the spring sport kids got out there, and they're practicing outside. Lacrosse is on the football fields, and, we see the track kids running outside, and we see the baseball still practicing in the gym some, but everybody kind of getting an early start to spring sport. And, sometimes we talk about complex issues here and sometimes just the simple things. And one of the things that's filling the training rooms at our high schools that we cover right now, and the trainers asked me to give a heads up about today, is shin splints. There's going to be, this time of year, there's so many kids who come home. And so for athletes and parents to realize that upwards, as kids are running outside after being inside for a while, upwards of 20%, 25, maybe as much as a third of kids will experience some shin pain. And I wanted to talk a little bit about just a basic prevention program for shin splints.
Okay.
So the key, Ray, is get on these early. Get on, if you're having shin pain, get on them early. One of the first things, of course, that you see everybody do a lot is stretch. And the muscle group you have to stretch is the calf muscle, because the strong, tight, underutilized calf muscles from the winter they overload the muscles in the front of the shin, and the muscles in the front of the shin will start pulling on the lining of the bone, and there's a lot of nerve endings in the lining of the bone, and kids will have this throbbing, aching pain when they run, known as shin splints. And because there's a pretty good number of pain nerve endings in this area, kids will have a fair bit of pain. So just amount of pain on its own is not a good indicator of how bad the shin splints are. But remember to start with a good calf stretching program, and then definitely don't skip on ice. This is an area where ice will help. Either put them in an ice whirlpool, an ice bucket, or ice with an ice cup up and down the shin. A good 12-minute icing for a kid who's starting to get shin splints is going to be a really big help. Thirdly, the trainers will start, if they're lasting a little bit longer, to maybe look at taping. A lot of times they'll actually tape the arch to take some of the pressure off the shins, or even talk to kids about getting an insert or an arch support in their shoe that will take some of the stress off the shin bone. And if through the beginnings of treatment and seeing your high school trainer, we're not getting progress in 10 to 14 days, and the pain is becoming more localized on the bone and things, then you may need to look at an evaluation with your trainer. And in some cases, if they're really worried about it progressing to a stress fracture, they may send it into a sports medicine doc or a primary doc to take a look and rule out stress fracture.
Joe, when we talk shin splints, what's the recovery time?
The recovery time can be from 1 day to 10 days or 2 weeks. With typical shin splints, it should be getting better. But sometimes if you catch these early, a day or two, sometimes 2 weeks. When we're getting past that point and you really have tried those preventative things that I said there, you've given them a good period of 2-3 weeks of a good trial, and they're not getting better, those might be the ones that we talk about possible stress fracture. Or even one other thing you and I have talked about that's become more and more common is a thing called exertional compartment syndrome. And that's a problem that is actually because of the muscles being actually taking up too much room in the fascial covering. And so typically we'd expect a good improvement in 2 to 3 weeks, Ray.
Those shin splints, sometimes the kids will get some soreness in the legs, and you don't know if it's shin splints. It might be. Is there something that's a dead giveaway that says these youngsters have shin splints?
Well, if there's any pain from the knee to the foot and up and down, usually it's pretty diffuse. It's not one pinpoint area. It's a pretty broad area along the shin. It's usually in the front on the inside or front on the outside of the shin. It's not anything harmful to begin treatment. That's often, I know that sounds like a funny way to diagnose these things. but the trainers may see 15 in a day. And so they see these kids in the high school and they put them on treatment, and 14 of the 15 will be better by the end of the week. And then it's the one maybe that needs a little bit more close observation. And what I'm saying is if they're not getting better in 2 or 3 weeks, then it may be something more advanced than shin splints. But anything in that front of the shin area fits for those 3 or 4 things I talked about that are very basic starter program of treating them. And if they get better, then they probably were shin splints.
Is there preventative measures we can have in place of pads on the shins or ice down after a workout, or is there anything at all?
Yeah, so ice down after a workout is definitely in the big 3 or 4 things we start with, and a lot of calf stretching. Any way that you can stretch the calf is good. Actually, taping can make this worse, taping of the shin itself. When the trainers tape, a lot of times they'll tape the arch to take pressure off, because a lot of times it's how much the foot pronates that puts a lot of pressure on those muscles in the front of the shin. And so an arch taping or an arch support, icing them down like you just said, stretching really good, maybe even a couple of days of an over-the-counter med that you like to use for your aches and pains like Aleve or Advil. And those are the 4 kind of basic starters that our trainers are taught to do. And then they look for those ones that are hanging out there that aren't getting better that could be a diagnosis of something more significant.
Great stuff this morning, Joe. Thanks. A lot of those kids out running, like you said, and sometimes push it a little bit. And you heard him say, ice down after that long workout. Thanks, Dr. Joe. We'll catch up with you next week.
Okay, Ray, you're going to be in Wahoo Land, right? I
am. Well, you and I are still getting together, okay?
Okay, would you please give me an update? Everybody in this town is pretty fired up about seeing how our tribe is looking this year. So get as much info as you can, Ray, okay?
And I can't wait, and I know you from a medical standpoint. You want to know how Brantley's doing, and I'll do my best.
Brantley and others. Thanks, Ray.
All right,
Have
Jeff.
a great week.
You too, my friend. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital.